Hey there! Before we get started with the video, please do give a like and subscribe if you like the content. That would really help me out on this channel. I also stream every Monday, Wednesday, Friday at 5 p.m. Central European Time on twitch.tv/funwithfondue. Okay, let's get started with the video then. So David Steadson, do you want to give us a short intro on yourself?
Yeah, from Australia originally. I moved to Sweden 20 years ago because of a girl, a Norwegian actually, but ironically enough, she now lives in Australia. Uh, that's another long story for another Twitch, but ended up staying and met another girl and now live in Sweden with a few kids and dogs and the whole Villa Volvo Vova type of situation. I used to work in research at the University of Queensland in Australia. Had a background as a behavioural scientist, and we worked on drink driving programs, teenage drinking, behaviour change around those things. Then, for various reasons, I actually ended up becoming a network administrator and started up one of Australia's first internet companies. Um, Long story short, a few years ago, I started merging the interests and looking at digital health, and that's what I've been working on the last few years.
Nice, nice. So I wanted to get you on because I've been following you on Twitter for some time now because you've been posting, I would say, like pretty much daily about the Swedish corona situation and the strategy that the government has taken here in Sweden, and criticizing it, analyzing it. You post a lot of graphs and data and stuff, which has been it's been really cool to get that stuff, especially in English because that is harder to get in English in Sweden.
Yep.
So I wanted to get you to talk about what has really been like the COVID strategy of Sweden. Let's start from there because I'm not sure that everyone knows what the strategy has been.
Controversy over that in the last week or so, actually, because the government had a web page up describing the strategy, not very well, I'd say, and they quietly edited it and changed it without telling anybody. But it was noticed. The internet doesn't forget, and it said the strategy was to control the level of infection so that healthcare doesn't get overwhelmed, and that has pretty much been the strategy from the beginning.
Mm.
And it hasn't really changed.
What are the like things that Sweden has done to control the spread so that healthcare would not get overwhelmed?
Well, much the same thing as most other countries did. It's just they didn't take the step further. So, for example, recommending physical distancing, washing your hands, um, telling people to work from home if they possibly could. That's a big one, and also limiting crowd sizes. It originally was put down to 500 and then 50, and now I believe it's at 8.
Mm.
So you can't really have any large meetings.
I also feel like the Swedish government has been very slow to react. Like I remember we went to work from home in like mid March last year, and I think we got like the recommendation to wash hands and social distance maybe like a month later or something. It was like very slow turnaround times.
The the thing that's become clear over the last year is that probably the single most important thing in responding to this pandemic was how quickly you act. Because if you originally it was estimated that every person who got infected on average 2 or 3 other people, and that would occur within a few days. So if you take a week or two waiting, then your 1,000 people who are infected becomes 2,000, 3,000, 6,000,
And the
twelve
thing,
thousand in no time at all.
yeah, and the thing is that it
Uh,
grows exponentially. It's not just linear.
yeah, that's exactly right. Um, And Sweden has always been just a little bit slower than everybody else in putting in even the actions we did put in. Uh, like closing down schools, or at least high schools, turning them to remote distance education. Basically occurred, well, they announced that it would start at the end of the week where school holidays started.
In June, right? Or when?
Yeah,
Yeah.
middle of June. Where a lot of other places shut down straight away. Places, I don't know if you guys did this in Finland, but in Norway they put in a quarantine for people traveling from Italy and China and everywhere almost immediately. If you coming into the country, you had to get tested, and they 2 weeks quarantine
I
to make
think
sure
there
you
was
weren't
something like that
infectious.
for people coming from Italy and China. I'm not 100% sure. Someone in chat can correct me if I'm wrong on this.
Yeah,
Yeah,
well,
pretty
we
much.
started
Yeah.
that here in
Okay.
Sweden about 3 weeks ago, so just a
Yeah.
little late.
Imagine 3 weeks ago in a pandemic that has been going on for almost a year now.
Yeah, I couldn't believe it. We actually had, we're a pretty open house. We have couch surfers here all the time, or at least we used to.
Mm.
And we had a Malaysian guy, a couch surfer, and he'd been in Mongolia and China. And he flew into Sweden from China, from Wuhan, in fact, I believe, is where he came through as a transit passenger. And he wasn't even stopped at the airport here in Sweden. And this is the end of March.
That's amazing.
Yeah, it's just unbelievable. No information, nothing. And guess what? We almost certainly all got infected with it then. The whole house did.
And the fact that there has been, like, from what it seems in Sweden, like no contract tracing either, or contact tracing, sorry, seems also peculiar.
Well, what do you think contact tracing involves?
I would imagine that for them it's asking who have you met, and then that's it.
Right. Well, I'll give an example. We all got confirmed positive again in my household a few weeks ago.
Mm.
And there was a questionnaire we had to fill out. I did it. My wife didn't, and the kids didn't do theirs either, but they also called us. We know exactly who infected us, and we also know who we may have infected. They never asked us for names, just wanted to know if the person that we'd met that may have been infected, if we told them that we were infectious. That was it. Normally with contract tracing, what you're trying to do is find, well, I'll give an example in Brisbane, my hometown in Australia. There was a cleaner in the quarantine facility that tested positive. They identified over 100 people that potentially were contacts of her over the previous few days and did over 15,000 tests to track down who may have been infected.
Slightly different approach.
Yeah, that's never even remotely happened here.
Yeah. Yeah. I mean, it's the slowness of the Swedish government has really surprised me because, like you said, like the recommendations to wash hands came in late, and like mask usage recommendations came in like beginning of January, like a month ago.
No, there's still no real recommendation
There
to wear
isn't?
masks. What there is they've recommended masks. Now, you got to understand the picture here from as a behavioral scientist and involved in how do you get people to change their behavior to improve health, which is what it's all about in a pandemic, isn't it? We're not.
Yes.
It's not about medicine. I've found it quite odd actually that all the experts you see being interviewed are nearly all doctors. All right, my background is not as a doctor, as a medical doctor, but it's doctors who get very little training in this, and we're talking about getting people to wash their hands, getting people to social distance, getting people to change their behavior, but they're instead talking to medical people who are great with medicine and stuff as being the experts, which is bizarre. So we're wanting to try to get people to change behavior. If you want to do that, you need a clear message from somebody you trust and you know exactly what to do, right? So the message here is wear masks on public transport, in peak hours, in peak hours, if it's on public transport where you can't book a seat.
There's way too many, like, if this then that, like it should just use masks
Right.
all the time, wash your hands.
Yeah, sorry. The general director of Folkhälsomyndigheten, the Swedish Public Health Authority, was actually caught photographed catching trains and buses in peak hour without masks.
Yeah, I saw
and
this.
He said, "Oh, yeah, I didn't realize the time," or the bus wasn't so crowded. Yeah, that's not how you get people to do anything.
No, it's not. And I know, of course, a very controversial figure in all of this has been Anders Tegnell, of course, and his approach to the whole pandemic. Because from my understanding, the way that it's structured in Sweden is that he kind of holds the keys into how the Swedish government implements stuff and what they can do.
Yeah, he seems to be the driver. Really, his boss, Jan Carlson, is where the buck should be stopping, and of course the Prime Minister. But Tegnell's very much been the face of the Swedish strategy.
For better and for worse.
Oh, yeah, do you want me to go there? Who's watching?
Anyone.
I'll tell you, I kind of got involved in tracking what was going on First of all, because well, we got sick, and there was this ridiculous thing with our Malaysian friend, couch surfer. But I was watching one of the initial press conferences, and somebody asked, I think, about closing schools, and he said, "Oh no, the research shows that closing schools doesn't help."
Mm.
And I thought, "Oh, okay, that's interesting. I would have thought it would help. It seemed obvious to me it would help." So I'm a former researcher, and so I thought, okay, I'll go look at the research. And I found it nearly universally said it does help. There was even a paper that Anders Tegnell himself was one of the co-authors on that shows that this does help. So I'm just kind of like immediately kind of get my ears up and wonder what's going on here. They're saying stuff that's simply not true, and that's pretty much when I guess I became an activist and really following the Swedish strategy closely.
Hmm. Then if we were to look at like where have the big failures and I guess successes, we should also mention those, credit where credit is due. Where do you feel like the Swedish strategy has succeeded and failed particularly?
Well, it's interesting you describe it as a failure because Sweden doesn't, or at least Swedish authorities don't. They consider the strategy here has been a success. And if we go back to what you asked me before about what is the strategy, they said the strategy is to keep infections down at a level such that healthcare wouldn't be overwhelmed. And we've successfully done that. So the strategy has worked. Um, Most people are kind of interested in how many people are getting sick and how many people are dying. But no, Tegnell in April was actually saying, somebody asked him, "What's your prognosis? How many people do you think are going to be dying in the next week?" And he said, "We're not looking at that. We're not doing projections on it." And it's continued the whole pandemic. They've not really been interested in the death toll. They had no interest in things like long COVID. Um, it's well, their focus very much in the first few months was how many people have actually been infected, because they've acknowledged that part of the strategy was that there'd be a side effect of herd immunity, um, which has, of course, caused a lot of controversy. So, from the Swedish authorities' perspective, the strategy has worked. From any kind of outside perspective, it's been a complete disaster. But if you're wondering, well, what's worked is people have worked at home a lot. I think it's something like 40% of people who started working from home. Social distancing has occurred. So the case is very clearly slowed. So I mentioned before 2 or 3 people getting infected by someone who was infected. It went down to between 1 and 1.5 people would be infected for each infected person. Then I think we actually got lucky, which was spring. Came in and people's behavior changed even more, being outside more, opening windows and ventilating more. And so that's when we got the reproduction number, that value R you've probably heard about, down below 1. So cases
Hmm.
started decreasing, and that was considered a success.
But then they picked up again during the fall.
Yeah, which a lot of people were going around saying that Sweden had succeeded. I've actually found a tweet I did in early of November, and based on the data I was looking at, it indicated there were between 5 and 10,000 people in Sweden who were probably infected, didn't know it, and would be going back to work soon. So it
Which is a
seemed pretty
disaster.
obvious to me. Yeah, it seemed pretty obvious to me we were heading to disaster. Yeah.
And it was funny because Tegnell talked about in the spring, like end of spring, he was saying, yeah, Finland and Norway might have smaller numbers than us now, but in the fall, they'll have a worse situation than we do because we'll have herd immunity.
So that was just absurd. And I kept trying to, I made bets with people on Twitter, any amount they wanted, that what, so Norway's going to catch up with us. Okay. It just,
Yeah,
when you looked at the numbers, it just didn't make any sense at all.
no,
And
and
it
I
was all
mean,
based on this false idea that immunity was going to build up and herd immunity would kick in.
mm,
And it never made any sense to me.
and actually talking about Finland and Norway, like, because if you look at like Finland and Norway are, of course, each country is different. We can't compare countries exactly to each other because they are different. Like comparing, for
Mm.
example, to New Zealand or Australia or the US would not be very fruitful because they're such different countries and so far away from us. But I think Norway and Finland are like fairly comparable. to Sweden because Nordic countries, bordering countries, similar population densities and sizes and populations.
Exactly.
But
When you're talking about epidemiology, it's always it's not like you can have two groups of people, you give one of them a pill and the other ones you give a sugar pill. You
mm,
can't do that. So there's always what you call confounders, things that are going to affect what you're looking at and make it harder to see what's really going on. But if a year and a half ago you'd asked me or any actual active epidemiologist, I certainly haven't been for many, many years, if you were going to set up an experiment to compare countries with the pandemic coming on, you'd absolutely pick the Nordics
mm,
because they're so similar. Norway was Sweden 100 years ago or something.
mm,
Finland and Sweden have been the same country as well.
yep, we have.
So there's so much similarities compared to say Belgium, which people always say are the United Kingdom. And
Mm,
Tegnell at one stage, it was bizarre. He said Sweden was more comparable to New York City. Can you believe that?
that doesn't make any sense. New York City is completely different, way more population dense than Sweden.
It's absolutely insane. It's just bizarre.
And looking at the
Yeah.
numbers now, like the amount of infections in Finland compared to the whole population is like 0.9%. Norway, it's
Mhm,
1.2%. These are the lowest two countries in Europe. And
mhm.
Sweden is in the top 10, like 6%. Like, it's a huge difference. And it's the same with the death counts as well, where Norway and Finland, it's 0.01% in relation to the population. In
Mhm.
Sweden, it's 0.12%. So
Not finished
how
yet.
how how is there like such a huge difference between these two areas, or these three areas, I
Because
should say?
because the strategy in Norway and Finland has been to get the number of infections down as much as possible, right? Um, if I think you guys have got a contract tracing app, so if somebody
Yep.
does get infected, you know who they've been in.
Yes.
They were actually there was hackathons that did many of those. Folkhälsomyndigheten even paid money for one to get designed and then decided not to do it.
That's so
So
weird.
and then they actively went out. There was actually 1 month here in Sweden where there were more tests to see who'd had the infection than to see who was actually infected, which goes to show, don't listen to what they say, listen to what they do. They were more
Mm,
interested in proving there was immunity. And Anders Tegnell and others were saying that Stockholm would reach herd immunity at the end of May, based on no data at all that actually indicated that. It was nothing more than hope. So if you've got countries like Finland and Norway that are actively trying to get as a few infected people as possible, and then a country like Sweden where that's not the strategy is just to make sure you don't have so many people infected that healthcare is damaged or and overwhelmed. Obviously, you're going to get more sick people, and if you get more sick people, you get more dead people.
mm-hmm.
This isn't difficult. You don't need a degree to understand that more people infected means more people sick means more people dying, and that's
Yes.
what
And I mean,
the something. Something I
no, go for it.
showed on Twitter last week is that Norrland here, the northern
Mm.
parts of Sweden, population 1.2 million, has had more people die than the entire of Norway in this pandemic.
It's really mind-boggling that Sweden has over 12,000 deaths right
Yeah.
now, where Finland and Norway both have less than 1,000 deaths. Like, and it was like this comparison was brought to Tengel at some point, and I think he said some really dangerous stuff as well, like really racist stuff. He said like one of the reasons why Finland has it like better is because Sweden has taken more immigrants. But like he didn't like directly say it's because of them, but it was a dangerous implication when he said that.
Well, it's not only a dangerous implication, it doesn't match the data. The first thing I looked at was, well, okay, there's no point comparing Norrland to Helsinki.
Mm,
Um, but I looked at, I don't think I actually looked at Helsinki, but I looked at Oslo, Copenhagen, and Stockholm and looked for the percent of people who are foreign born in each of those three countries. And it was virtually exactly the same, 26, 27%. So it just doesn't make sense. And then, of course, Norrland, when I first moved to Sweden, I'm an immigrant and I actually moved to Norrland. And I can tell you there wasn't a lot of immigrants up there, certainly not
mm,
like Oslo or Copenhagen. It just makes no sense.
It really doesn't, and it's like, why is Sweden so insistent on this strategy? Like, everything around is saying kind of like that there's a lot of people dying and this could be prevented and this could be combated, yet the government decides not
Yeah.
to.
Yeah, there's been a lot of talk about the Sverigebilden, the image of Sweden,
Mm.
and you've probably seen, as myself and quite a few other people have been under quite heavy attack by Swedish media in the last week and a half.
Let's actually
And
talk
it
about
started
that.
right at, yeah,
Yeah, let's actually talk about that. So this is probably a lot of people outside of Sweden are super not aware of this, but so there's
mm,
like actually, like, just walk us through like what happened, because I've seen like bits and pieces of it on Twitter, but I know that people who have been in like a Facebook group have been like under attack by Swedish media and just like by Swedish people as well.
yeah. So there was a Facebook chat group, had about 200 members, and like all Facebook chat groups, it means the vast majority of them weren't active on there. I was hardly ever on there, and it was called Media Watchdogs of Sweden. It was started by an Irishman, and probably a couple of other people I actually don't know, to try to get Sweden to change strategy, because we're looking at what's going on here and thinking people are dying unnecessarily. This strategy is insane, and I'll outright say it: the Swedish authorities are lying to people about it. And from my understanding, the strategy behind this group was to try to influence international media to actually give out the true facts about what was going on, so that would pressure the Swedish government to change strategy. It's actually been a complete failure, but that was the idea. And then a week or so ago, Swedish radio, which is funded by the government, came out with an attack on this Facebook group, calling it an organized disinformation influence group that was spreading lies and disinformation about Sweden to foreign media and governments. And I'm like, this is a Facebook chat group. What are they talking about? It sounded like a St. Petersburg troll factory or something. It's just absolutely absurd. And for the whole week now, there's been kind of back and forward debate in Swedish media about whether this is appropriate or not. And there's been so much bullshit spread about the whole thing. And the amazing thing is, though, is I constantly ask people, okay, what has this group said that's wrong? What have people in this
Mm.
group said that's wrong? What is it they said to foreign media that was wrong?
Mm.
And none of the media, nobody attacking us or criticizing us is coming up with any kind of significant example.
That is really bizarre that the government would see a 200-person private Facebook group as a threat to Swedish, I don't even know what. Like,
Well, it gets worse. There's a media personality here. She's a scientist at Karolinska Institute called Dr. Emma Franz. And she's constantly being interviewed in media and in newspapers as an expert. And she actually retweeted this article and said the group was a danger to democracy. And then Folkhälsomyndigheten, the Swedish Public Health Authority, their official Twitter account, being run by a guy who used to actually he was psyops for the Swedish government, retweets this claim that we're a threat to democracy.
Cool.
So,
Super cool.
yeah,
And
so I'm kind of officially an enemy of the state now, which
enemy of the
has
state, yeah.
been fun.
Fuck the monarchy.
Viva la Republic, yeah.
Exactly. But, and from my understanding, one of the founders of this group is a Portuguese woman. I started following her just recently on Twitter.
Yeah, I don't know if she's one of the founders or not, but I know she's been one of the people that's been very active in it. Yeah.
And she was like, over the fall, I think she like went out into public and trying to convince people to like, hey, wear masks and please do
So well,
something.
this secret group was actively lined up outside of press conferences with masks and protesting.
Yeah.
And they've been doing that. They did that for months with proper distancing, of course, and masks.
And
And
I
they were
think,
abused and they were spat on. I would have gone and
yeah,
joined them, except I live a few hours away from Stockholm.
yeah, that's what she was posting. Like, people would like call them traitors, like literally spit on them in the middle of a pandemic, harass them. Like there were some people who were like genuinely like interested and did have like a good discussion, but they did get like generally harassed by people, which it's really mind-boggling to me that in the US you have protests against mask wearing, and in Sweden you have protests for mask wearing. It feels like it's completely upside down.
It really is. It really is weird. I think part of the issue is this particular group is a lot of immigrants and expats, not entirely, but there is a lot of them. And we consume a lot of media, both Swedish media, but also international media. And Swedes, I don't think, aren't. And so they're getting a really false view of the pandemic. You know, there would be horror stories about outbreak in Oslo, and you'd have a look, and it was like 130 cases, and Stockholm was reporting 5,000.
Exactly.
Yeah, I heard you earlier talking about LA. LA's got almost the same population as Sweden. How many cases was it? 1,600 or something? You said
it was like almost 2K.
Yeah, well,
in like
Sweden's having about 4,000 cases a day at the moment, and it's now increasing again. But everywhere else is having disasters and lockdowns and all this horrible stuff going on. And we've actually on the Twitter groups I'm involved with, we've actually seen many cases of the Swedish media basically manipulating their images and graphs to make Sweden look better.
Yes, I saw that. It was like the y-axis was like insanely huge, so the graph looked like this tiny because the y-axis was so skewed that like the graph was small because of that. But it was such a crazy manipulation of the data.
Yep, there was another one where I think it was reporting on testing, and they showed the amounts of tests being done in Denmark versus the amount of tests done in Sweden.
Yes, I saw that.
And the amount in Sweden was a tiny percentage of it, but they showed two bar graphs where it
was like half and half,
where they were almost the same. You know, Sweden was only a little bit smaller.
Yeah,
it was just
because those were so like just mind-boggling, honestly. Just like how it's just lying. Like if you can't show data in this type of manner because you are actively lying about the impact of the data. Like it's just,
I think so. If you're deliberately doing stuff to mislead what people believe, then that's lying. No matter how you may want to argue the semantics.
Yes. I don't know what the intention was there, but it kind of doesn't matter because the impact is the same. You are trying to minimize the impact of the data and the reality of the situation, trying to make it look better than it actually is. Here I found the...
Yeah, exactly. And that's why Swedes think everything's been going well here. And yeah, more than 12,000 dead, and I'm predicting we'll probably get at least another 4,000 or so.
That's horrible. Like 12,000 people dead is not like an insignificant amount of people. That's like that's like a hockey stadium of people just dead in a year.
It's more than 1 in every 1,000 Swedes.
Yeah,
that's actually a lot. You know, we went into mourning with the Indian Ocean tsunami, which killed around 500, and the Estonia ferry tragedy, which killed similar amounts. But 12,500 now, and that's an undercount.
Yeah.
And nobody seems to care. Seriously, it's bizarre to me.
It is crazy.
I told Australian media that back at Midsummer, I actually put the flag at half mast in honor of all the people that died. I think it was about 5,000 or 6,000 then. And people would ask me like, who died? Well, 6,000 people died.
Yeah, because I was like, I haven't been watching the data for the past few months that actively, but like, especially in the beginning, I was watching it like every day. I was like, these numbers are crazy. But it felt like this was not being reported of like how much it's really happening.
And one of the other things that's been so bizarre is it's almost hilarious is the health authority starts their press conferences with like the status in the world and the status in Europe, and they'd be picking different countries to compare Sweden with, and they were literally comparing Sweden with Liechtenstein, and countries like that. I'm like, what are you doing?
When there's literally comparable countries right next to Sweden. Like there's Finland,
Yeah,
Norway,
yeah,
Denmark. These are comparable countries, similar countries in
exactly.
culture and population densities. Like to go out of your way to ignore these neighboring countries to find things that are like these kind of work with what we're trying to say is dishonest at best.
Mm, yeah.
It's here
And then when we
I
point
found
it
the
out, we get
y-axis.
attacked.
That is bizarre. Like and that really does speak to the fact that Swedish people might not be so internationally media literate. And I feel like there is like the kind of flip side or downside of having such strong trust in the institutions in Sweden is that if someone questions those institutions, that's seen as an attack on everyone.
Well, that's what's really almost sad about this is all of the Nordics have high trust in government.
Mm.
And if you've got a pandemic, as I said before, one of the things you want to do is you've got to change behavior. So you need some trusted person asking you to change.
Yes.
And people here trust. And it's one of the reasons why Norway and Finland has done so well. But it's also had the same effect, or the opposite effect here in Sweden, in that people have trusted the government. They've done what the government has asked, and they've believed the government even when the government has been blatantly lying to them.
Yeah.
And Sweden could have been like Norway and Finland and one of the
Could
best
have.
in the world so
Yes.
easily. But there's
Easily.
so many natural advantages we have here, from the population density you mentioned, where we're some of the highest number of single person households in the world.
Yep.
You know, if you're infected and go home in Spain, then there's a whole bunch of people at home you're going to infect.
Absolutely.
You're here, you go home and you infect the cat. You know, it's not the same problem.
No, not at all. What about then the vaccine rollout? What's the situation currently with Sweden and the vaccines?
I'm not going to be too critical there because it's been a problem everywhere in Europe.
Mm.
So things have actually improved a lot in a lot of ways in the last few months in the second half of the pandemic and the second wave. Been doing a lot more testing. In spring, it was impossible to know what was going on because there was just no testing. Now we've been doing plenty of testing, so I've been able to make pretty accurate predictions of where things are going. The vaccines rolling out slowly. There's 300,000 or 400,000 people I think have been vaccinated now, but I've heard that those numbers are actually slow getting in, so that's actually been more than that. So there's going to be a challenge, but I'm not going to be critical of Sweden. It's problems throughout Europe.
For sure. Actually, that getting the data in slow, that's actually an interesting point because Sweden has not been having daily press conferences for a while
Mm,
now. They only report data from I think Tuesday to Friday, if I'm not mistaken. So there's like a
that's correct. Yep.
and and I remember they've been criticized. Like it took a while, but at some point the media was saying like, "Hey, why is this data coming in so slowly?" And their responses mostly been like, "Oh well, it's just how it is. We can't do it any faster," which feels really weird to me in a pandemic to say that we can't get the data faster when every day counts, and then saying, "Oh well, we'll just have a 3 day gap when we don't report anything." And
Oh, it was worse at Christmas.
oh yeah,
Like we were literally having around about 100 people a day dying, and they went on holidays. There was a period where we got no data for almost 2 weeks, I think it was, maybe one report. Um, and I'm not just talking about us who commenting on Twitter. This was data
mm,
going to the ECDC, the
yeah,
European Centre for Disease Control, and the World Health Organization.
yeah. This is
And
official data on like how many people are
yeah,
infected,
yeah.
how many
So
people
nobody
die,
was
and there's
getting
a
this data.
lag. There's like a
And
few-week lag or something. There's like quite a significant lag in the data.
well, right from the beginning, this is actually what got me a lot of people following me on Twitter. Is I started actually tracking the lag and graphing it. So I'd keep a copy of the data they published every day or every weekday, and graph it, and then get the same data as they published in the next day, and graph that on the same graph. And you discover that they were adding deaths and removing deaths from 2, 3, 4 weeks ago. Um, and so the problem was, and I honestly think Anders Tegnell didn't even seem to understand this in the spring. He seems to now, but still ignores it and says stupid things. That they'd be looking at their graphs and thinking there was 40 people a day dying, but that's because you wouldn't know how many people are dying now for another 2 weeks.
Yeah, exactly.
And it's the same thing now. After the Christmas break, it actually was almost a month delay before you could actually get a good picture of what was going on.
And in a pandemic, like you don't have that type of time.
Yeah, just everybody going on holidays in a pandemic. It's Sweden. Fika's more important. Holiday's more important. Somebody died? Oh, yeah, sorry. We'll record that in the data in a month.
It is really bewildering. And do you feel like there's any sign of a change in how Sweden handles this whole case, the situation?
A lot of people have thought the government has taken a few more steps, like the masks on trains and stuff in peak hour. Yeah, that kind of ridiculous advice really smacks of compromise. And Anders Tegnell has pretty much said he doesn't think it'll make any difference, and he doesn't wear one, and all this kind of stuff. So I think that didn't really come from Folkhälsomyndigheten. I think that probably came from the government, or maybe Socialstyrelsen or one of the regional health authorities. So I haven't really seen any change. Their cases are decreasing, so they're happy. Cases are starting to go up again now, as expected, because of these new variants coming out of England and South Africa and everywhere. But yeah, I don't think there's been any significant change, and I don't think there will be.
That's really a shame because, again, 12,000 people dead is a lot of people to die in a year. Excess deaths, that is.
Yeah.
It's a lot. And from my understanding, also, like one of the big reasons why there have been so many people dead is that it's spread into care homes for elderly people, and that was a big cause of death.
Well, that's the case everywhere. This virus kills people that are older. You almost double your risk of dying for every 5 years of life or something. But again, when I look at the data on that, it was almost the same percentage of people in aged care died in Norway, and Sweden has had more people die under the age of 70 than Norway has had total. It's that's been a challenge everywhere.
Yeah.
There was actually an official report from what's called the Corona Commission here, or their first interim report, and they said the main reason for the high death toll in Sweden is the high spread of the virus in the community. And that was basically ignored by the media.
Cool.
Because that's a direct outcome of the strategy.
It is a percentage game. Like if you have more infections and a certain percentage dies, then you're gonna have more deaths. That's just how percentages work.
Yeah, back in end of November, I looked at the infection data, looked at how fast it was spreading, made some calculations based on what's called the infection fatality rate and particular ages. And I worked out that, okay, we're going to basically reach the peak that we had in wave 1 about Christmas time. An analyst in Florida, Mark Bivan, did the same thing and came up with pretty much the same answer. He had it a little earlier than me. And we ended up being completely correct. It was entirely predictable. Because you spoke about the law of large numbers earlier, and when you've got big numbers, you can really predict quite well what's going to happen.
And the sad thing is, it's not a thing you want to be right on. You don't want to be right on, these many people roughly are going to die or get infected. You don't want to be right on this stuff. You really don't.
I'm not afraid to admit that when it became true and I was writing about it on Twitter, and you'll see it in my Twitter posts, I cried. Because I was so sad because it's so unnecessary.
It is. This is preventable, and the fact that the government and the healthcare officials are not doing the things that would help is frustrating.
It's not like we don't have examples of what work, is it?
Exactly. We have examples of what works.
We can just look next door.
Literally next door. And
literally next door.
It's weird because I wear a mask whenever I go out here. And I've been doing that since summer, I think, because I went back home to Finland for my summer vacation. I think after that I started using the mask.
Right.
And I remember I've been getting a lot of, not as many looks nowadays, but definitely throughout the fall, a lot of weird looks from people because I'm wearing a mask. And now some people are wearing masks as well, but it's not super widespread, I would say.
It's definitely increased. I always wear a mask when I'm going out, and right now it's actually pointless for me to wear a mask. I've just come out of an infection. I'm not infectious, so I'm not going to infect anybody else, and I can't get infected. I wear the mask to show other people it's okay to wear a mask and give them the courage to do it when so many people aren't.
I
But
mean,
I have seen a noticeable increase.
yes,
I'm so that's a good thing. But the problem is with mask wearing is the whole point of mask wearing is to actually stop you infecting other people much more
yes,
than
exactly.
to stop you getting infected.
Yes.
Well, it's not the whole point, but it's the main point of why we
Mm,
want people wearing masks. So you and me wearing masks isn't going to have a big effect on that. But if you get 7 million people wearing masks, it makes a huge difference.
yes,
I
absolutely.
actually, in the spring, I think it was Emma France or maybe Agnes Wold, Professor Agnes Wold, who are two of the defenders of the Swedish strategy and are in the media as experts, promoted a study out of Norway showing that, well, for, if 200,000 people wore masks, it would only like drop infections by 1 or 2 people a week.
Mm,
When I looked at the report, it was based on how many people were infected in Norway. And when I redid it with Swedish numbers, it actually showed that if you had 80% of Swedes wearing masks, it would drop the infections by thousands a day, and the infections would die out within weeks.
yeah.
Uh, but it's
And
still being fought against, and they're literally telling people that masks are risky.
yeah, that's
It's insane.
I honestly don't understand like that part of it. And at some point I know their response was that they don't want to tell people to wear masks because people would get false security and they would use the masks wrong and they wouldn't adhere to like social distancing because of that.
Mm.
But I think that's a really poor cop out in the fact that if people are using masks wrong, we have to teach them how to use them right. Like, no one knows how to use a condom. Like, if you give someone a condom who's never seen one, they wouldn't know how to use it, but we know how to use it because we're taught how to use it and we learn how to use it. And it's the same with masks. Like, it's a new thing for us, most of us here in the West. It's a new thing, but we just have to teach people how to wear them.
Even a badly worn mask, these people who wear it under their nose and stuff, that still actually decreases the risk of transmission. So if you get 8 million people doing it, it'll make a big effect to the
Yes.
pandemic.
I think
Um,
it's some point
so
thing that,
they've
oh, sorry, go
they've
ahead.
got to they've got to prove to us, they've got to provide the evidence that wearing masks, they say that people won't social distance or people will touch their face more.
Mm,
Now, a lot of this stuff has actually been studied and it doesn't happen. About the only study I've seen that indicates potentially maybe an issue was in some places where they issued mask mandates. More people went out, so they went out of their home shopping a little bit more often. But there was no evidence that it actually increased any risk otherwise.
mm.
But you've got to show you. I keep telling people this is insane. You're literally putting 2 walls between the virus and somebody's airways, and you're going to tell me it doesn't work? Yeah,
I mean,
makes no sense.
if there were studies to show this, I mean, sure, I would change my mind, but I
Yeah.
haven't seen anything conclusive to say that they don't work. That maybe the only thing to say against them is that it's hard to say that they alone, the masks alone, don't aren't enough. We need other things besides just using masks. But if
And
we use
nobody's ever
masks,
claimed masks alone are enough.
exactly, exactly. It's not like we
Mm,
say just use masks and then everything will
mm.
magically be better. No, it's use masks, social distance, wash your hands, work from home. All these different things need to be done together as a cohesive strategy, and then that will help. I mean, even Daniel at some point said like, because he was asked about people wearing masks, and this was somewhere in like I think October or November. He said like, oh, but the people who are wearing masks in Sweden, they're tourists, and it's
Yep.
like,
Yeah, he said that. It's again
what
the immigrants, isn't it?
tourists?
You're weird.
Like, we're in the middle of a pandemic. This was like
Mm.
October or November, like in the middle of the pandemic when things were not good. And he's talking about tourists coming to Sweden. From what countries? What tourists?
And the health minister actually said about the same time that they couldn't recommend masks because some people couldn't afford them, and that wouldn't be fair.
It's just, it's incredible. It is, it just,
Really, they were spending like 100,000 crowns per patient treating people with remdesivir, which was an unproven medical treatment. It's now been shown not to work. But they're worried about people buying masks for a few crowns. Government could have given everybody a mask.
yeah, it's, they're not like hundreds of euros or thousands of euros. Literally, you can
No.
get a pack of them for like 10 euros or 100
I,
kroner.
I bought a slightly higher tech one, a couple of 100 crowns that's washable.
Yeah.
So, yeah, No problem.
It's just, it is really mind-boggling, and it's been weird to see this.
Yeah,
It's been weird
it's
to see,
been
and it was just like
yeah.
I was in Finland in actually Christmas and whole of January, just so I could spend some time with friends, and
Mm.
that I had a chance to go, and I went still, and it was just like not everyone wore masks there, but way more people wore masks in Finland than here. Like it was a
Yeah,
notable difference,
yeah, it's insane.
and it's been weird to see how Swedish people are so reluctant to accept criticism of their institutions and their government. That is one of the things that has really
Mm.
shocked me.
Do you think that would happen in Finland? Because we're talking about the high trust, and you guys have got high trust in government as well.
I I
If
think yes, you would have a similar problem in Finland as well. Would it be to the same extent? I'm not sure, but I think we would probably have a similar issue in Finland as well.
okay, it's a form of nationalism, and
It is absolutely.
it's I kind of understand it, but for God's sake, just read the evidence, read the research. Yeah,
I mean,
there's been so many scientists calling out Sweden, and they're
yes,
just ignored.
in Finland you can see this whenever you criticize the police in Finland, you
Mm,
get a lot of pushback. Like I've done
yeah.
that. There was like a case in late summer where the police the pepper sprayed peaceful protesters who were blocking a
Mm.
road, and that got a lot of news because it was kind of excessive. In my opinion, it's excessive, and I made a video about it, and I got some comments. I had like really long Facebook posts about this because some people are like, "Well, why were they doing this? If the police do something, then it must be okay." And it's like, "Oh boy."
Well, you could have been Sweden then on this then, because
Yep.
from what I understand, the person in charge of the epidemiologist, chief epidemiologist or something in Finland, actually wanted to follow the Swedish model,
Hmm.
and it was the government that pushed back against it.
I am very glad of the current Finnish government. It's not perfect by any means. Don't get me wrong,
Which
but
government is?
exactly. But it is like the first proper left leaning government that we've had in a long time. Like if this would have been run by like the National Coalition and the Finns
Mm.
party, I think we would be in a very different situation right now because I don't think they would have reacted in the same way as our current government. I really hope that like Sweden doesn't just hope that we'll just wait for the vaccine and then it'll be all be good after then. It's like there's the variations and this is
Do you
not
think
the
things are? I mean, it really depends on these new variants coming up, which are
mm,
starting to take over here now. It's like 20-30% of cases is probably approaching now with the British variant. But I'm hopeful that spring's going to kick in 5 or 6 weeks like it did last year, and then cases will start dropping off significantly again.
hopefully.
But it's still going to be long and slow like it was in spring, and a lot more people are going to get sick, and a lot more people are going to die.
And the thing is, like, this is not the last pandemic like this that we're gonna see in coming years.
Yeah, it's really interesting because I've kind of thought this was just kind of okay. We kind of got lucky. This is a test run,
Mm,
but an epidemiologist, British American one, Debbie Schroeder, I think it was. She kind of thought maybe this was the big one because it kind of hit that spot in the middle where people wouldn't take it seriously enough.
mm,
If we were having 100 people, 100 children a day dying, then I can guarantee you Sweden would have said lockdown, lockdown. But when it's mostly people over the age of 70, nobody seems to care. Um, so maybe this one is a bad one because it was just in that sweet spot where people wouldn't take it seriously enough.
exactly. And we don't have the infrastructures in place to
Yeah, but we've
properly
we've we've
contact trace
learned
and
an
everything.
awful lot now.
We have
Not least that, damn, we can get vaccines fast now.
yes, and I,
Did,
sorry,
did you read how quickly Medina developed their vaccine?
no, I didn't.
2 days.
2 days?
2 days.
Damn!
They got the
Holy shit!
genome. They had it in 2 days. This was in January. They were shipping out samples by the end of February. The first human trial started March 16th.
Damn! Scientists are like the people who have been working on these vaccines.
Yeah, it's
Like
unbelievable.
amazing work, and like literally couldn't be doing more than they
Yeah,
are.
just
But I
amazing.
think an important part here is like after this is over, quote unquote. Um, like the lessons will, like, it's really important that we learn the lessons, that we set up proper contact tracing, and that if and when this happens again, that we catch it early and contain it, and we don't let it spread. And like, we have to put those things into place, because otherwise it's just going to happen again. There's a question.
Will.
There's a question in
Yep.
chat. What seems to be the ulterior motive for this strategy, Swedish strategy, I assume, holding on to it? Nationalism, business-oriented people in charge, party politics, popularity, other?
I think originally it was simply a misreading of the situation. They thought the virus was less dangerous than it is, and they also thought it spread a lot more, even worse, more easily than it does.
Mm-hmm.
So they thought this was the only option, and building up immunity in the population would lead to Sweden doing better overall. So I think that's where it started, and since then, I think when it's been so obvious that's wrong, that it's just been a matter of pride, both on the parts of the experts and on the Swedish population. I think it doesn't help that the Prime Minister doesn't have a lot of education. Now, I'm personally, I think it's great that somebody who was a welder, I think he didn't even finish that, can go up to grow up and become Prime Minister. I think that's fantastic. But he has put too much faith in the government appointed experts, and hasn't, I don't think, got the background to be able to evaluate it, or the confidence, or the scientific confidence to be able to judge what's going on and say this is wrong. So I think that's where it's come from.
Right. Makes sense.
Mm.
Okay. If there's no other question in chat, then thank you, David, very much. I appreciate you taking the time and talking with us.
Been good to chat.
Yeah, it was great. I hope you have a great week and a great evening.
I will. You too.
Okay. Bye. Hey, thank you so much for watching this video. If you liked it, please do like and subscribe down there. That would help me out a lot. Also, I stream every Monday, Wednesday, Friday at 5 p.m. on twitch.tv/funwithfondue show. If you have any questions, feel free to drop in on a stream and come hang out with us. Link to that also down there. And lastly, I have a Patreon, patreon.com/funwithfondue. If you want to support me monetarily and get access to some exclusive stuff, you can also get a link to that down there. Hope you have a good one. See you in the next video.